Ladies and gentlemen, the US continues to experience annual flu seasons where there is a spike in flu-related illnesses, flu complications, hospitalization, and death. According to the CDC, flu hospitalizations they continue to increase annually. This puts pressure and stress on the health service delivery institutions such as hospitals and clinics. Statistics show that a total of 49,708 people died of flu in the year 2015. This is the highest record that we are having here. Of course, most of these years from 2009 to 2017, the least number that died is 42,524, with the maximum highest being recorded in 2015, which is 49,708 graves. That's a very huge and a big death count that we're having here. And this qualify to be a policy issue that need to be addressed by way of making sure that there is adequate preparation for flu seasons that are coming. This meant to cope with the increased staffing requirements for clinics and hospitals alike. Therefore, this project that I'm presenting right now, it seeks to shed light on when to send extra medical staff to clinics and hospitals across the US states, and how many medical staffers are required at any given instance, and to which states at any given time. So the key questions that I seek to answer in this presentation: number one, who exactly is at risk of flu illness, complications, hospitalization, or death? That's number one. Number two, is there any link between the population density of any given state and the death count, flu death count in that very same state? That has to be clarified. And number three, is it possible to pinpoint when a flu season is starting and also when is it ending, so that there's a way of planning for staffing requirements of all hospitals and clinics? My name is Innocent Bayai, and I am an aspiring data analyst with Career Foundry, and my presentation is trying to present on the preparation for the flu season, and I'm going to answer all the questions that I've raised in this first segment of my presentation. There is compelling evidence to show that those that are 65 years and above, they are more susceptible to flu death compared to the non-vulnerable age groups that are below 65 years. While it's the distribution of those that are 65 years and above differs with each state, is what I'm showing here. The distribution is here with each state. What is still a fact is that those that are above 65, they are more vulnerable to flu complications, illnesses, hospitalizations, and death. And we have the top 10 states on the other side that are recording the highest casualties, with California being the highest, of course, of the 10 states that we're having here. So it is clear that those that are 65 and above, they are more susceptible compared to those that are below 65. And at the same time, there's a spatial distribution that shows that certain states, especially those that are presented in this slide, they are more susceptible, or their count of flu-related death is exceptionally high. Let me also look at the relationship between the population density of these states versus the flu death count that we're having in these states. So the spatial distribution that I'm showing here, it shows that there is a great there's a strong positive relationship between the population density and the count of flu death that we receive at any given time. So states that seem to have high population density, such as California here, they also have the highest count of flu death. And those that seem to be having the least population density, such as Alaska, they also have the lowest or even nil flu-related death at any given instance. So there's a relationship between the population density of any state and the count of flu-related death at any given instance. Then there's also need of relating to the question that I raised regarding seasonality of flu death. It can be picked from this distribution that we are having on the left side, that there is an annual trend where flu death spikes at a given point in every year, and then there's a drop that follows, or a dip that follows after that, making it a seasonal trend. But when it comes to a year, or on a yearly basis, this is the average of what we've been seeing, and I'm making use of 10 states that recorded the worst death, flu-related death here. Now, what it shows is that flu death tends to spike or increase from October of every year, and it tends to reach a maximum, all right, in January of every year, before taking a steep dip thereafter. So what it means is, it is very possible, according to this yearly trend, to figure out when flu season starts and also when it is likely to recede. Making use of these insights, the key conclusions that I'm putting forward: number one, it is possible, right, making use of this bar graph that I'm having here from January to December, which is an average death count in most of these states, right? Flu death follows a season, right? So it is very possible for us to plan in advance for the staffing needs of clinics and hospitals, because it is very possible for us to figure out when the spike in these death and complications in flu hospitalizations are starting to increase. That's the first thing. Then number two, those that are vulnerable, 65 years and above, they are more susceptible to flu-related death, and they should be targeted for flu shots. And the last conclusion that I'm having here is that those states that are having a high population density, such as California, Washington, Texas, they also recorded the highest flu death at any given instance. So our staffing must prioritize these states so that we have a way of clamping down on the complications, the illnesses, hospitalizations, and also reducing the count of death. However, there are still issues that require further research and data requirements. Number one, there's need of understanding how flu vaccines are likely to reduce the flu illnesses. That's number one. Number two, the complications, the hospitalizations, and also death. So that's another tranche of research that has to be done. And also number two, there's also need of figuring out how many medical staffers are we having in each hospital and clinic in these different states, so that we understand the gap that require maybe additional medical staff, so that there's a way of addressing and meeting the staffing requirements during the flu season. At the same time, additional data is required, especially trying to understand how many patients can each medical staffer effectively save, so that we understand how many can be released to meet the additional demand during the flu season. With these insights, I thank you for this opportunity of going through this presentation. Let me allow those that have questions to pick those questions out, and I should be able to relate to all those questions that you are raising given the conclusions, insights that I've provided in this presentation. I thank you.